I myself was born and raised as a Lutheran Christian in my home country, Germany. And I've been engaged in the global fight against HIV/AIDS for more than 20 years. And throughout this period, I've worked with many faith communities around the world. And I would say in this period, I've experienced both the best and sometimes also the worst. So the best in terms of the compassionate care and the holistic healing that indeed many faith communities around the world are providing for millions of people. And we do recognize that as an indispensable contribution to the struggle against this deadly disease. I've sometimes also experienced the bad expressions of denial and hypocrisy and stigmatization. But my first observation following basically the last 24 hours here is that we've come a long way. This was a very remarkable meeting, and the discussions were at a level that would have been impossible 10 or 20 years ago. And that was very encouraging for me. I think, this kind of level of conversation would not have happened at the beginning, when indeed the atmosphere was much more an atmosphere of fear and ignorance, and as many people have said, stigma and discrimination towards those affected by the disease. So that's very encouraging. And you might ask, what has contributed to that? One personal experience. About 15 years ago, I was privileged to chair the working group of the World Council of Churches on HIV/AIDS. And we had the almost impossible task to develop a policy for the World Council that could be approved by the Central Committee on HIV/AIDS. So that was in the year 1994, before any treatment was available and when HIV was in the rise, on all continents. And in this commission, we had people from all regions of the world. We had, academic theologians, we had church leaders, we had people living with the disease, we had people living openly with sexual diversity. And after the first meeting, I thought, I give back my mandate. This is impossible. We can never come to an agreement on anything. And we had to discuss the difficult questions that you've been discussing on the relationship between sin and disease and prevention and discrimination and all of that. In the end, we were able to submit a policy. And that was because we deliberately went out to the countries and listened to the voices. Something that has been probably the most impressive part also of this conference. That many, personal statements I've heard over the last 24 hours. And that was exactly also what changed around our commission, because that is so different. You cannot approach this subject from an academic perspective. You will never come to an agreement, whether within one religion, leave alone between religions. But when we indeed listen to those who are living with and are affected by the diseases, that very often changes the complete dialogue that we are having. And so we submitted then in the end the text, and you find an excerpt in your folder, which I've seen yesterday when I came. But you've not invited me, I guess, as a Lutheran Christian. You've invited me as a representative of the Global Fund to fight AIDS, tuberculosis, and malaria. Now, you will be pleased to hear that I will not talk much about the Global Fund. I will leave that to you. I've brought one little short report that is out there on the table, and you can, get quite a bit of information from that. We produced that actually for the donors meeting that indeed we will have, over the next 2 days, and it will start tonight in The Hague. And tomorrow we are presenting to donors from all around the world 3 scenarios for their consideration, ranging between $13 and $20 billion for the next 3 years, which would enable the Global Fund to continue to support programs around the world. And when it comes to the Global Fund, you will be most interested in what's the relationship between the faith communities and the Global Fund. And I might also say, maybe the story here is mixed. And some of you have mentioned the Global Fund in both ways, I would say, and that's quite justified. I was encouraged to see that actually in this room, there are many people with quite some positive experiences, and some of you mentioned that. And there are indeed stories from clinics in Khayelitsha to programs that we are doing with secular and faith communities in Indonesia, as Dr. Taha mentioned yesterday. There are positive examples from Democratic Republic of Congo to also the Lutheran World Federation that has been a recipient of Global Fund money. So there are, fortunately, a number of very good examples, and we are fully committed to work with faith communities around the world. And I have to mention here one initiative in particular, as Bishop Hansen is here from the Lutheran Church of North America. We have a particular partnership now going on between the Global Fund and the Lutheran Church in America. And I really would like to express our gratitude also for your leadership on that, because I think it might be a model in a sense of how religious bodies can relate to the Global Fund, which goes beyond the funding, actually. It's a real partnership, how we can also engage faith communities. In this case, it's about malaria, but it could be applied to HIV/AIDS in the same way. But I do also hear the voices who say the Global Fund is quite complex and sometimes cumbersome to work with and demanding in filling the proposals and the reporting requirements. And that indeed has been one of the major challenges for us to work with faith communities. But I just want to say, for the Global Fund, faith communities are absolutely critical. And I can pledge to you that we want to work with you, we want to channel money through faith communities, because otherwise we cannot hope to make progress against AIDS or against other diseases. So that is our commitment. My challenge is a word that has been mentioned today several times, and that is accountability. It was raised here as a kind of accountability also between, I think, religious bodies. But in the case of a funding organization like the Global Fund, it is about the accountability for the money. And that's where some of the challenges have been over the last couple of years. Because we do have to demand a level of accountability that I found, and that's another observation, that was challenging for many faith communities. You might be used to be accountable to a higher authority. And you might say, we are doing fantastic work and we care about our people, and all of that is correct. But if you want to receive money from an organization like the Global Fund, what it would apply to many other international organizations as well, there needs to be then a different level of accountability. And we use all these ugly terms of monitoring and evaluation and frameworks and indicators and all that. So I just want to mention that as a challenge. As we want to work with you, we have to think how we can improve that and also how we can build the capacity in your communities to deal with this particular point. But my final point and my final challenge is that we have now, I think, also to look beyond HIV/AIDS. This disease has been a very special one, and it has really been a catalyst for so many things. A catalyst for recognizing the dignity of human life, respect exactly for differences, but most of all for human rights. The human right not to be discriminated against, but also the human right to health and equal treatment. Every person, regardless where he or she has been born, has the right to the highest attainable level of health. And that's not new. That has been proclaimed by the United Nations many, many years ago. But I believe no other movement over the last decades has taken that so seriously as the AIDS movement, to demand that we people living with the disease, we deserve the same human right to health and health care as anybody else, and not just in the rich countries, but also in the poor countries. Nobody else before this has expressed it in the same forceful way. And it has come not from the faith communities, and it has not come from the churches. It came from a solidarity movement, an unprecedented solidarity movement around the world by the people living with the diseases. And we should really pay tribute, I think, to this fight. And some of the leaders have also been here with us in this conference. But now we have to take this and say, let's take that beyond HIV/AIDS, because it applies to health and other problems in general. And the challenge, I think, now for the faith leaders is to become the real advocates for this human right to health and to dignity and to social services. And it was mentioned today that, I think it was Professor Farid, to say this is the lacking piece, if you like, the advocacy piece, that faith leaders have to stand up and influence, politicians and others. And we haven't heard that voice so strongly. But if there was one message, I think, also coming out of this meeting, I would like to see that you become advocates for health, equality, and human dignity. And you as religious leaders, you are visionaries. And you should be visionaries for a world in which basic social rights are available for everyone. and then we would make this world a better place together.